welcome back to Transform. I'm Juliette Wooten, and I'm so excited because today we have a very special guest in my studio, triple board certified neurologist with impressive background and extensive experiences. Welcome, Dr. J. Dr. J, thank you very much for coming in today. And Dr. J, why don't we talk a little bit about you, because you have so much experience and such a variety of impressive successes. So I want people to know how you can help them.
Sure, I'm really very happy to be here, and thank you for having me. So I'm Dr. Jaivir Rathore. I'm a neurologist. I'm certified in epilepsy, adult neurology, and clinical neurophysiology. My background, I've been trained at University of Illinois, Chicago, and then Cleveland Clinic in Ohio, and finally at Johns Hopkins in Baltimore, Maryland. I've been in Florida for the last 3 years or so, and currently serving as a co-chair for the Epilepsy Foundation Florida and my own medical center, Falcon Advanced Neurology and Epilepsy Freedom Center in Orlando, Florida. So I'm triple board certified. Only 3.56% of the neurologists in the entire United States can claim that. So really happy, and I'm really grateful that I'm here today to talk about Parkinson's disease.
We are so lucky to have Dr. J here in the Florida. And yes, today we're talking, guys, about the Parkinson disease in the relation to exercise and the nutrition. And this session is very personal for me because Dr. J was able to improve drastically quality of the life of my mother-in-law who has a Parkinson disease. And thank you so much, Dr. J, from the bottom of my heart. She is very loved by the family, and we've been so worried, but since we met Dr. J, the family dynamic has changed, that's for sure. So Dr. J, before we're gonna dive for question and answer today, which I gathered from the real people, from the gym, from the channel, from you guys, I want to talk a little bit, just to spend a few minutes, what is actually Parkinson's disease and the basics of it, Dr. J.
So Parkinson's disease, it's a Parkinson's phenomena that includes quite a few symptoms, the variety of them. So it is a complex, progressive, neurological degenerative condition, initially described by James Parkinson in early 1800s, and basically described by motor symptoms and non-motor symptoms. Motor symptoms are, you can use the acronym of TRAP, which is tremors, and then you have rigidity or somewhat spasticity, akinesia or hypokinesia, that means slowing of the movements, and P for postural instability, which is associated with balance and put you at risk for falls. And the non-motor symptoms, basically, which are sleep related, people can have poor sleep, insomnia, or they can have abnormal movements during the sleep called REM behavior disorder. There can be anxiety, depression, and in some cases there can be seeing things or hearing things called hallucinations. So this whole complex situation, it falls under what we call as Parkinson's disease.
Wow, I'm so excited to learn about it myself, because since I mentioned my mother-in-law, who I dearly love, I didn't even think about it. I had a few friends in the past who had it, but I never really dive in, and recently we got so many questions, and I gathered those questions from the real people of the channel and in the gym. So the first question is, what is the main cause of Parkinson's disease? What would you say it is?
So there's the Parkinson's disease is, you don't know exact reason, but we say that it could be nature versus nurture, or nature is like your genetic predisposition to having this disease, or that most of the time, which is usually a genetic basis and can be seen in up to 10 to 15% of the patients. So the majority, approximately 80–85% of the patients, we don't know exact reason why they get it, but we have some hypothesis. The lifestyle, that come on these days, we have so many chemicals, pesticides, herbicides that is floating around in our food. So those may have a role to play. In some cases, it could be head trauma. For example, you must have seen the famous boxer Muhammad Ali, Cassius Clay. So that is called Parkinson's pugilistica, because of the hit to the head that can happen. Or other cases of head trauma, fall, concussions, football players, those kind of things. That is also a possible cause for this. So yes, genetic and other lifestyle things that has predisposed us to this degenerative condition in the brain, which basically affects mainly what we say is the substantia nigra pars compacta. That is a part of the brain's, midbrain, which produces a chemical called dopamine. And in most of the cases, we have seen that there is a reduction of dopamine producing neurons in the brain. But it is not actually restricted to only this. There are other chemicals, neurochemicals that work in the brain. For example, serotonin, the deficiency of that leads to anxiety and depression, along with norepinephrine. And also there are certain other chemicals like acetylcholine, which is involved in your memory, in your movements. So all those are affected. So Parkinson's disease, and over the period of time, as we have learned about this disease, we have started calling it Parkinson's plus, because of all the symptoms that goes with this, including the typical motor symptoms, along with memory, dementia. It's also called Parkinson's dementia.
I will have that question too later on coming on. Would you in your practice, Dr. J, what is the earliest cases of the Parkinson you observe when it's actually visible? And I'm asking it because I have a very dear friend of mine who had a grandmother, and she started to show the Parkinson's signs at 80s. But my friend, she is only 49 and she's scared till death. She is working out like crazy, changing her diet, and she constantly thinking about it, which probably not a good thing too. But what is the earliest you see in your practice when it's actually noticeable?
Yes, so we usually divide it as the age of 50, before 50 or after 50. If it's before 50, it is usually called young onset Parkinson's disease. And the youngest patient I had in my practice was 38-year-old gentleman. Many people really did not even, he saw many other doctors and they did not want to believe that a 38-year-old can have a Parkinson's disease. So they have been putting it together, some movement disorder and stuff. But finally, when I diagnosed him and treated him, he did better. After 50, usually 60 and later. And as you grow older, the risk of having Parkinson's disease increases, especially after 80, 85. Approximately about 4% of males can have it and 2% of females can have it. So age is certainly a factor in this.
And you have such a holistic and unique approach when you treat in your patients, so it's not just the medication. Would you say, Dr. J, that the younger patients, when it's noticed a little bit earlier, they respond a little bit better to the treatment, and the improvements you can see much faster than when it's noticed later?
Oh yes. The treatment has to be started early, and there have been a lot of clinical trials looking at at what stage you are treated, because some of the subtle signs of Parkinson's disease, as I mentioned earlier, they are missed in the diagnosis and the treatment is delayed. People tend to do better when they are started treatment, and again, the holistic treatment. I'm not talking about just medication wise. So all the things. So the first thing you need to do when you see a patient, before you decide what treatment you're going to offer, is what we call as a unified Parkinson's disease rating scale. There are 4 different sections. First 2 are filled by the patient and the rest are done by the physician. And once you have the whole thing filled out and then you review it, then you come up with what challenges the patient is having, and then you have to treat according to that.
I see. Well, that's a very good answer. Next question I have a lot of them today. What are usually the first signs of the Parkinson's disease?
So again, as I said, there could be very subtle motor signs which are easy to diagnose because they are motor signs. You can see hand tremors, which is usually rhythmic resting tremor like this.
I saw that.
Yeah. And the other signs could be little rigidities. So if you move your hand around, this wrist movement should be very smooth. But in case of Parkinson's disease, it could be like a cogwheel rigidity. So your hand wrist goes, with this cogwheel nature to it. There can be, if it is, so that can be the stage 1. So there can be 5 different stages. Stage 1 is asymmetric. So usually one side is affected more than the other compared to the other essential tremors, which are very fine.
Like you mean the one arm is going to be moving a little bit,
exactly,
like more than other. What about facial?
Facial expressions could reduce as the disease progresses, what we call as mask faces. So they have very less, they would speak with a flat face. The voice will get slower and muffled. So that's and the handwriting is affected too. So their handwriting, instead of a normal length of their signatures or writing their names, it will be smaller, what we call as micrographia. And then micrographia, bradykinesia, so that is reduced movement. So the strides are shorter. Their movements are smaller. They don't swing their arms that much. So when you see their gait, you will see that they won't move their hands that much, and they walk with shorter steps. And as the disease progresses, they will have a forward flexion, and the strides will be so shorter that they will try to catch themselves, what is typically called a shuffling gait.
Shuffling gait.
And they are very less flexible, so they're high risk of falls. If for any reason it's uneven surface or they trip on something, they really can't catch themselves very good. So one of the tests that we do when we see a patient is called posterior pull test. So we pull them backwards and see if they can catch themselves. So fall precaution is really an important aspect to reduce the risk and prevent falls and injuries.
Yes. I'm glad you're talking about the movements, because I have another friend, actually. She is only 49 years old. And I actually told her about you because she has a neurologist, but I don't think they figured it out right. So recently, just a few months ago, she noticed that when she tries to pick up something, like a pen from the floor or like even a kiss, she can't pick it up from the first time. And she told me that about the few months before, and nothing changed. And her neurologist, again, like you said, they have hard to believe when you are young and fit and something can happen. And there is another sign. She would say, I would put my keys or something, and short memory is affected. Not the long term. Of course, she's remembering everything, but the short-term memory, like where did she put the keys? Where did she put like stuff to the refrigerator? What shelf? Would you say she needs to check it out?
Exactly. I mean, that is the very classic thing that happens with memory and dexterity.
Short-term?
Yes, short-term memory. Wow. Because the thing is, the long-term memory is a whole network. So you make some short-term memories, you consolidate over a period of time. That is mostly done in your stage 3 sleep. And then the whole network of memory has that information. So you tend not to forget your ABCs and your letters and where were you born and raised, but you may forget the name of your neighbor who you just met. Wow. What did you eat this morning or yesterday, or what recent conversation you had with a family member or a friend. So those things are not fully potentiated in your long-term memory system. So certainly that can happen, especially because it affects the verbal memory hippocampus and the visual and spatial memory on the right side of the hippocampus. So those are affected because of this whole new neurodegeneration that happens in the Parkinson's disease. So
you would say it certainly could be a sign.
Absolutely, it could be, but again, there has to be looked at as a whole. Yeah. The patient needs to examine of the whole, because only memory thing could be because of some other dementia, could be because of some metabolic reasons, could be because of thyroid problem. Hypothyroidism can give you poor memory. Certain vitamins and mineral deficiency can do that. And so there are so many other reasons which can cause memory problems, including depression, which the other name for depression is pseudo-dementia. Mm-hmm. So every patient has to be seen as a whole. But again, this could be one of the symptoms for Parkinson's disease as well. Yeah, for the
Parkinson's disease. Well, thank you so much. It was a comprehensive answer, guys. I have a next question. So this is, how fast does the Parkinson progresses? We a little bit talk about it, but there is probably signs in a different age group as well.
So this is probably one of the most common questions the patient and their family ask, because they want to know what's going to happen to prepare for the future. And again, answer to that is every individual is different. The reason for their Parkinson's disease is different. At what stage they are, it also depends on that, and what treatment they will get. That will also decide on that. But it is you cannot really tell how fast somebody will have decline or they will be stable for a while. So that is every individual has a different thing. So you don't freak out by knowing that, oh my gosh, I got Parkinson's and only have a few years before I decline.
So it can be 10 years, it can be 15 years.
Exactly. So at least when it is diagnosed, in most of the cases, it is either stage 2 or stage 3. So stage 1 is when you have one-sided tremors. Stage 2, when both sides are involved. Stage 3, when you have some balance problems. Stage 4, when you really need a walker to walk around, a cane for walk around. And stage 5 is when literally you cannot walk and you are wheelchair bound. So it's hard to say who's going to go to stage 5. It's not necessary that everybody will go to the stage 5. It has been studied, and they have found that from diagnosis to 10 years from that, there is no difference in the life expectancy. But after 10 years or so, those who have more than 10 years of history of Parkinson's disease, there is some increase in their mortality. So the risk of death after 10 years is slightly higher. But it's not
connected directly to the Parkinson.
The thing it is, actually, it can cause some heart rhythm problems and stuff, and there can be some sudden cardiac arrest and other things can happen. But again, doesn't happen to everybody, so don't freak out with that thing. If you take care of yourself, if you are regularly following with a neurologist and they are doing a good job with the, overall care, I think most people do very well.
Most people do really well, and they can take care of themselves.
Exactly. But again, you need to have your family well informed about it, your loved ones about it, and as best they can help you with certain things, because small helps at home. If you live by yourself, if your hands have tremors and you can't really fix your breakfast and lunch and dinner by yourself, there is a risk of injury because of the tremors and because of the rigidity. So some help from the family members would certainly be helpful. And again, we have to be conscious about the risk of injury from falls or some other things.
Yes. Well, that was a comprehensive answer. Thank you, Dr. J. Next question, guys, is, I love this question, and I was thinking about it too. Do all Parkinson patients get dementia? Do all Parkinson patients get dementia?
So yeah, this is a really interesting question. Dementia is a little bit moderate to severe. The milder version called MCI, or mild cognitive impairment, it can happen to some extent in most patients. So some people in early stages, as I said, it is not just basal ganglia. The whole brain gets involved with multiple neurochemicals involved. So some level of cognitive difficulties can happen. And sometimes, because it affects your sleep, that can affect your memory because you're not sleeping good. So that's where a role of a good neurologist comes in, to make sure that they're sleeping good and they feel good, because anxiety and depression can worsen their memory. And all those things put together can affect your cognitive abilities, which is, the whole brain functioning. So we can take care of that and limit it to mild cognitive impairment. And usually this is in 60s and plus. In younger patients, usually they are have a motor symptoms, tremors, mostly tremors, and gait instability and stuff. But that happening to a young person can put a lot of emotional distress, and that can affect the cognitive abilities and memories. So yes, most people have some level of cognitive difficulties.
But it's not necessarily going to lead to the dementia in each
Not
and every
necessarily,
patient.
yes, but to some extent. But again, we know there is no cure yet. So there are a lot of research happening, stem cell treatment and all those research is going on. But at this time, the treatment and everything is a supportive role, and to make sure that they live their life as normal as possible, and closely watch for any signs of worsening. But again, not everybody would go for a dementia. Yep.
Thank you so much. That was a great answer. All right, one of my favorite questions, of course, the connection between exercise and Parkinson's disease.
Exactly. This is a really, really important question, because we talked about the motor symptoms, the balance, the rigidity in the joints and everything, postural instability, all these things. Actually, the good treatment for that is the right combination between the medications as well as exercise. And exercise, as described by many, and Lee Silverman initially started as a voice therapy called LSVT, and then they have expanded on that, and LSVT big and LSVT loud. So big is for full extent and movements during stretching, power, strength training, balance training, multitasking. All those exercises are really good because it creates new connection in your brain. It trains your brain, retrains your brain, rather I should say, with those of the things that you're not using that much. Again, when your brain, because of the Parkinson, if you're moving less, your steps are shorter, all those things, over a period of time, if you really don't do exercise, there is a disuse atrophy. If you don't use it, you lose it.
You lose it, you're right.
Exactly. So you have to basically do these exercises. As I said, all aspects of the training that you do in your shows, I would definitely say that is good. At the same time, it should be individualized to the patient who is in different stages. Stage 1, stage 2, probably you can do more intense exercises in stage 1 and stage 2. 3 and 4 is that you have to curtail according to the patient's need and their ability to do that. Even those who are wheelchair bound, I would say still they can do certain exercises. So exercise, no doubt, hands down, is for everybody who is in the Parkinson's disease.
Wow, thank you. And guys, we do a lot of compound exercises, Dr. J, which is like when the body performs, multitasking, as you said, which is require mind to work and require your body parts to work. For example, we do the squat and the bicep curl, and at the same time we squat back down and do overhead press. It's a challenging mind-body exercises, but intuitively I always thought, wow, this is such a great way to train your brain, kind of like you're reading the books. Exactly. And you constantly training your brain to move to a different direction.
So let me add to that one more point, that it is not just the flexibilities and the balance and strength building. Also, if you do in the morning from 6 to 8 a.m., you release certain neurochemicals called endorphins, which also elevates your mood and helps with the anxiety, depression that can happen in Parkinson's disease. So guys, you should definitely do that first thing in the morning. And that's really, and it's also advised 30 minutes a day at least, or 2.5 hours a week. That is the recommended exercise timeline for the week. Yeah.
Our classes come on at 5:30 a.m. every single morning.
Perfect time.
And actually today I shared with my group in a gym that we're going to be having this session, and I asked them, what would you like guys to ask if you saw Dr. J? And that said, yes, certainly about exercises. And what type of the exercises? Like would be the strengths more helpful, would be the yoga more helpful, would be the stability, would be the cardio more often? Do you have some recommendation?
I would say all of the above. All of the above. So strength building, balance training, and stretching as much as you can do, side, every possible action, and especially where the patient is having challenges. If the patient says that, I lose my balance while doing certain things, I would say force on, put your more energy and time on that part of exercise for them. And again, say out loud when you're doing those exercises, because one of the symptoms is muffling of the voice, hoarseness and husky voice. So if you speak out loud during that time exercise, that's going to help with that symptoms, your facial expressions, everything,
So it's involved the whole body.
Exactly. And those who have even the arm swinging problems, and those who are not walking properly, because swinging of arm is actually a mechanism to balance yourself. When your right hand goes in the front and your left leg goes in the front, they counterbalance each other to keep your axial body in the center. So those who don't swing their arms, they are at higher risk of falling. So actually they should intentionally swing their arms, because subconsciously they are not doing that. So all those fine things, so I always walk my patients in my clinic, and then examine them if they're lifting their feet off the ground, are they swinging their arms, and then how smoothly they are turning, how many steps they are taking. And then I do the posterior pull test. I check for their rigidities, all those aspects, even listening to their voice, I can tell. And I ask them to write something, maybe their name or signature, and then I progressively follow them. That is the treatment that we are doing is helping those things, okay? So those are the things that you have to really pay attention and document at the initial visit and then follow up on that.
What an amazing information. I'm learning so much today. Thank you so much, Dr. J. Next question. What to eat when fighting Parkinson's disease for a healthy brain? What to eat, Dr. J?
What to eat? Oh, this is really a very important aspect of it. So the basic idea for food in Parkinson's disease is that do the food which is less inflammatory, because Parkinson's disease, if you see in the pathophysiology of it, is the inflammation in the brain because of an abnormal protein folding. Actually, to be honest with you, this is a waste disposal failure for the brain. So there are some abnormal proteins, alpha-synuclein proteins. They fold abnormally, called Lewy bodies, and they get deposited in the brain, mostly in this basal ganglia area, that causes a sense of inflammation. And microglias, which are astrocytes and microglias, they go in there and they do some cleaning business. There's inflammation, more neurons die. There is also some mechanism of mitochondrial energy thing. So again, connecting this with the food, if you eat food which are freshly cooked, all right, they are not tinned or canned foods because they have certain preservatives don't know. There are certain foods which could have some hormones and stuff that are given. Dairy and milk have been probably presumed to be because of some hormones. So freshly eaten foods, antioxidants, I can't stress enough on that. So if you take a decent dose of antioxidants, which could be CoQ10, which could be fish oil, omega-3 fatty acid, flax seeds, these are really helpful. So I highly recommend having a decent dose of antioxidants in your food. Caffeine or tea, they have been proven in the many clinical trials to really reduce the risk or even help with that. So healthy diet and regular exercise, these are the pillars of actually preventing to some extent, and also to reduce the rate of decline in those who have already been diagnosed.
Thank you so much, Dr. J. Well, that's completely in line, guys, what we do every single day. A lot of green leafy vegetables, of course, kale, spinach, broccoli. As you said, CoQ10 is a great supplement. What would you say about turmeric? Because turmeric is a highly inflammatory, and I recommend it to all of my clients.
It's definitely very helpful, and it has been proven to be very anti-inflammatory. Don't cook it too much, because people say you lose that effect. So if you really, you can put it in your food, or you can mix it with the milk and all those things. They have antibacterial, anti-inflammatory properties. They help you when you're really sick with something to help recover from that quickly. And again, I would highly recommend turmeric as well.
Thank you. I have my own recipe. I take the coconut milk or the almond milk, keep it a little bit warm on a stove, and I put just half of the teaspoon of the fresh turmeric, just the one you get in a grocery store, and I think it just has an amazing result. I can feel it in my joints after the workout. If I don't take my turmeric for a few days, I can feel it.
There's one more point in that the gut health, the gut flora, the bacterial flora, what we call a condition that is associated with Parkinson's disease is called SIBO, or small intestine bacterial overgrowth. So many times people may have this overgrowth of bacteria in their gut that causes some inflammation, and then that limits the amount of nutrients they can absorb. And sometimes even when the medications are not working, we have to suspect that. So there are some hydrogen breath test that we can do. We can look at the stool test to make sure that it's not bacterial overgrowth. So certain probiotics they can do in addition to good healthy food can limit. So gut flora, definitely a very important aspect of it as well.
Do you have any recommendation, Dr. J, for the probiotic strains, like specific? I mean, I'm not asking for the brands, but specific what to look for, because there is so many different companies, and you don't really know what you get in the pill.
So I don't have any clinical trials that have shown one superior to others, but I have quite a few patients who use seeds and the other brands for gut flora probiotics.
Yeah. Thank you very much. Okay, next question is foods and diets to avoid when you have Parkinson's disease?
So
Foods?
We talked about that, caffeine is one that has shown, along with tea, that has shown to be this, and to avoid the food that well that has some pesticides, herbicides being used. So organic food, but again, in today's market, there have been trials and they have looked into that many of the food that are claimed to be organic are actually not.
Unfortunately not.
So if you have space around your house, and if you have the hobby of doing your kitchen garden, I would highly recommend that. So grow your own vegetables at least to some extent. You would know what you're eating, right? And avoid some artificial colors and some other random stuff that are out there. You don't know where they're coming from. So be very careful what you eat.
So we just basically need to stick with the food which is growing in the nature, just a nice regular food like fruits, vegetables, nuts, no hydrogenated oils. As much natural is the better. It's the best thing for the body.
Coconut oil, coconut milk, and all those, they have great amount of medium chain triglycerides, which have been shown to really help many patients with even dementias. They have shown that when brain uses these instead of glucose as their source of energy, they tend to do better.
Wow. Thank you so much, Dr. J. Okay, this is the next question. I don't remember who I got it from, but I have it in my list. Can you drink alcohol with the Parkinson's disease?
Oh, yeah.
Do you ever get that question?
This is really very common and very commonly asked question to me in my clinic as well. Even a drop of alcohol is neurotoxic. We've been told this thing. But again, if you can have a red wine, which has some other beneficial effects as well, I would not encourage you to use alcohol that often. But once in a while, maybe once or twice a week, if you want to have a little red wine, I'm okay with that.
So just a glass of wine twice a week, that would make no harm.
Yes, I mean that would be a good balance. I don't want to restrict because many of the patients, especially in their 60s to 80s and 90s, that's their time to enjoy their retirement. They have their friends, they meet, and they have a small glass of wine. That has a whole big impact on their sense of well-being. So I don't want to take it away, but I want to say that moderation is the answer for that. But again, I would strongly recommend not to do hard liquor.
Yes.
Red wine, we can do that.
Guys, stick with the wine, right? And as you said, it's not just a glass of wine, it's a social time for the people. I mean, when they can relax and feel joyful and feel happy, yes. And that would definitely help to heal.
Exactly.
As well. Well, I mean, very good answer. I like this answer because I love glass of wine occasionally, and I'm just glad to hear that it makes you a good. All right, next question. Could exercise and nutrition dramatically transform Parkinson's patients?
Yes, and especially in the early stages. If you do things, regular exercise, watch what you eat, you can certainly either have the impact of that disease minimized, and you can have a longer, healthier life with minimal symptoms. So again, having the diagnosis is not something that, oh my gosh, I only have 5 to 10 years and then it's going to worsen. So if you do regular exercise, you eat healthy, make sure you're sleeping good, make sure your mental health is good, you're feeling good. All those things, if you do, you can reduce the impact of the disease and reduce the rate of decline that can happen with that.
Social connection,
absolutely,
family support,
yes,
being joyful, eating good, exercising will definitely extend and probably slow it down in some point.
Yes.
Well, thank you, Dr. J. Can you prevent Parkinson's disease in general? And will the diet and exercise help if you have a genetically predisposition? I mean, let's say your grandmother had, your grandfather had, and you are in your 50s. If you exercise and eating good, practicing the well-being, the good habits, can you actually prevent it to even show up?
So the question is, if you have a genetic tendency, especially it puts you at risk for having a young onset Parkinson's disease. So if you have a strong family history, I would highly encourage you to get a genetic testing done to know what to expect. Especially there are certain known 7 to 8 which are very common genetic mutations that are associated with that. So you basically make sure that you do everything right after that. Would you be able to completely avoid it? Maybe not, but would you be able to minimize its effect? Absolutely yes. So there is a whole phenomena of cognitive reserve. So the more you build your cognitive reserve in your early ages, that any disease, whether it is Alzheimer's disease or Parkinson's disease or other forms of dementia, you can minimize them, and especially the whole brain health with getting good oxygen. Regular exercise sends a lot of oxygen. When you do aerobics, your heart pumps faster, and the deeper core of your brain, especially the small blood vessels, that's where the basal ganglia is. It is the core in the middle of the brain. It gets more blood. So there is one pathophysiology, if you look at, which is of mitochondrial degeneration, which is the energy source, the powerhouse of the brain. By doing regular exercise, by of course giving good nutrients to the brain, you can certainly either prevent to some extent or reduce its impact on you.
Wow, very good answer, Dr. J. Thank you so much. I had some observation done in my fitness classes, and I was waiting for this session to ask Dr. J. Dr. J, this is a question coming from me. Would you say that males and females affected a little bit differently by Parkinson's disease, and the percentages are different?
Yes, in early stages, not so much, but 80, 85 and above, the data that tells us that about 4% of males get it and 2% of females can get it. So it's certainly there is a age factor and then a gender factor as well. So certainly that has maybe some hormonal role to play, or some exposure in their day-to-day activities. Again, nature and nurture plays into that. So certainly there is a factor, especially age-based, yes.
Thank you so much, Dr. J, for this answer. That was such a fantastic session, Dr. J, and we're about to finalize it. But I'm a very practical girl, and I just want to leave you guys with a very practical advices, which you already got a lot today. Dr. J, can you recommend simple things to do on a daily basis for the people to keep healthy, to keep vital, and hopefully prevent any neurological disorders?
So guys, this is no-brainer that healthy lifestyle, regular exercise, watch what you eat, make sure your body weight and your all the parameters that you should have at the annual checkup, keep all those things in place and do regular exercises that I can't stress enough. Actually I need to do that more. I'm telling you this, guys, but I understand in today's busy lifestyle, it is hard to do that. And the best time, there has been studies to look at that you're 3 times more likely stick to a exercise program if you do first thing in the morning. So before you do your rest of the business of the day, get it out of your way. So do first thing in the morning, get up and have some regular exercises. Aerobics, cardio is one of the best one that you can do. Of course, the weight training, motor strength, all those are even greater. But first thing is to race your heart. Race your heart. It sends extra blood to your heart, extra blood to your brain, improves your mental well-being, makes you feel great, keeps you in shape, and of course, prevents all these neurodegenerative conditions. Absolutely. So exercise, I can't stress enough.
Thank you so much, Dr. J. It was such a pleasure to have you with us today. Thank you so much for watching this video. If you're not subscribed to the channel yet, make sure, guys, you subscribe and hit that bell button. Do that so I can remind you to stay on top on your daily fitness. See you in my next video.